Hello, my name is Dr. Diwan S. Raja. Today I will discuss about nursemaid's elbow. Nursemaid's elbow, also known as radial head subluxation, is a common injury among young children, typically occurs in children under 5 years of age. It occurs when one of the bones in the forearm, that is the radius, slips out of its normal position at the superior radial ulnar joint. This the this not yet developed head of the radius and the laxity of the annular ligament of the radius allow the head to sublux. Occur when the child is lifted by the wrist. It is caused by a partial tear or loosening of the annular ligament and causes the radial head to slip out of the position. The anatomy of nursemaid's elbow, radius and ulna, these are two forearm bones. They articulate with that of the humerus to form the elbow joint. They also articulate to each other to form the superior radial nerve joint and inferior radial nerve joint. Our concern is in the superior radio-ulnar joint. Annular ligament, this ligament wraps around the head of the radius and stabilizes it against the ulna, allowing smooth rotation of the forearm. Radial head, this is the rounded top part of the radius that fits snugly within the annular ligament. In a nursemaid's elbow, the radial head slips out from under the annular ligament due to a sudden pulling force. This results in the partial dislocation, subluxation of the radial head. Okay, here is the superior radial nerve joint. Here is the annular ligament. Here there is subluxation and the radius is coming out. Okay, it is loosened from this annular ligament. And to prevent this, we have to follow this practice. We should not do any of this activity to the child. Causes, we just discussed. We have seen the image. Pulling on the hand or wrist, such as pulling child's up by one hand, swinging them by their hands, or jerking their arm to prevent a fall. Less commonly, a fall on the outstretched hand. Symptom, immediate pain in the elbow and reluctance to use the affected upper limb. The child may hold their upper limb slightly bent at the elbow close to their body. So pain is significant. Limited range of motion, especially in rotating the forearm. Treatment, reduction maneuver, we have an image. The doctor can often reduce the dislocation by gently rotating the forearm. That means the child has done it in pronation. The physician should supinate it. Okay, supinate and flexing the elbow, supination and flexing the elbow. The child often experiences immediate relief and regains normal arm movement. Immobilization typically not required after reduction, although child might be cautious with the arm for a short period. So this is the maneuver to manage it. So apply pressure at the radial head, grasp wrist and apply slight traction. Supinate the wrist while flexing the elbow to 90 degrees. Prevention, just you have seen the image, avoid pulling, tugging and swinging young children by the wrist or hand. Encourage safe play and lifting practices. Nursemaid's elbow is rarely a serious condition and usually does not cause long-term damage if treated promptly. However, some children might experience recurrent episodes, especially if they have a more lax annular ligament. And that's all about nursemaid's elbow. the dislocation of the upper part of the radius from the normal position with the ulna and tenural ligament. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.